So hello everyone, welcome to Tilganga Institute of Ophthalmology. I'm Sagar and I'm a cornea, cataract and refractive surgeon here at Tilganga. So today we're going to talk something that has changed millions of lives worldwide. So this world is such a beautiful place to be in, and Nepal as such, it's regarded as one of the most beautiful places to live in. So you and I can see this beautiful landscapes, the snow-capped mountains, the green hills and the plains of the Tarai. But imagine all these people who have to wake up every day and the first thing they have to do in the morning is to put on their glasses or either contact lens and start their day. So it's a surgery that's done to these people who can embrace this without having any dependency on glasses or contact lens. So this is a surgery that's done mainly to get rid of the glasses. So there are many types of refractive surgery. So usually the front part of the eye is called the cornea, and this is the major refracting surface of the eye. And then we have the lens, that's a part of the eye that lies behind the cornea inside the eye. So the major focusing part of the eye is the cornea and the lens. So whenever the rays of light has to travel from distance, it passes through the cornea and then through the lens and then has to focus on the retina. So if there is any way that the rays of the lights are not focused on the retina, we have to change the shape of the cornea either by laser or we do surgeries by implanting a lens, an artificial lens, and this is what the different types of refractive surgeries are all about. So if you are 18 years and above, and then if you have been wearing glasses and your glasses have been stable since the past 1 year, then anyone is a good candidate. Regarding that, you don't have any other ocular conditions. It's a fast and it's basically a painless thing. Usually our patients, once they undergo surgery, they usually say that I felt like there was nothing that happened to my eye. So it's usually a fast and it's usually a painless surgery. So usually the surgery, it's just 5-6 minutes. In 5-6 minutes we get done with both the eyes. The laser part is, however, just like 8 to 10 seconds per each eye. So usually for the laser surgeries, you can see as soon as the very next day. Usually most of our patients, what they say is like the night of the surgery, they were able to see. So usually it's that fast and that quick. Most people usually have the very good vision the very next day that they get operated, but usually the healing time depends from people to people, so it's usually about like a few weeks to about a month. Usually not. Once you undergo a laser surgery, it's usually lifelong and permanent. But there are things, once you reach the age of 40, that's when you have problem of seeing the near things. So that's when you might have to wear a secondary glass to adjust to the near vision. Patients are very anxious about, and they want to know whether once they do the surgery, do they have to do it the second time. So usually this is just a one-time procedure, so usually most people don't have to undergo a second surgery. But as I said, later when they reach 40 or 45, then they'll have to eventually adjust to a near vision and they'll have to wear plus glasses. So usually with the advancement of technology, with the lasers being so fast and so superior, with the technologies getting better each day, usually it's a very risk-free, it's a hassle-free. There are some bouts of pain, and then there are some bouts about dry eye, but these are very minimum with the advanced surgeries nowadays. Yes, as I said, with the advancement of the technologies, we do both eyes on the same setting, and it's usually just a 5-minute procedure for both the eyes. So with the advancing world, everybody wants to be the better version of themselves. Everybody wants to look good or look beautiful, and then so this is the surgery that's merely done to boost up their confidence. So when we see the patients before and then after surgery, sometimes we're even in awe that we don't even recognize the patient because they are a different personality, totally a different person after the surgery. And now with everybody being more active, being more into active sports, so they don't want to wear glasses. So this is a surgery that's done to get rid of the glasses. They don't have to be dependent on the glasses. So these are some of the benefits of the surgeries. Yes, if you are the right candidate and if you undergo the surgery and if there is a smooth recovery, then of course the surgery can replace your glasses forever. So as I said, this is a surgery that's been done to millions of people worldwide, and then there are lives that changes just in about a matter of 5 minutes. So the people that we see before and after are totally different. They come with much more confidence. There's a glare in their personality. There's a glow in their personality. They are more confident with that. So this totally changes their outlook in life, and they are so happy than more so ever. So at Tilganga, there are three refractive surgeons, Dr. Bandana, Dr. Kausal, and myself. So anybody who wants to get operated or wants to just have to come and have a checkup, they can always come and visit our institute, and the checkup is hassle-free, the investigation is hassle-free, and there's a quick appointment that you can get. So if you think that you want to get rid of your glasses and you want to see this beautiful world, now is the time, and you can always visit us here at Tilganga Institute of Ophthalmology. Thank you so much.